All right, welcome back, everybody. Who took that break to put on a little bit more lipstick, right? Yes, you did. So let me tell you all a story real quick. I used to be a local TV reporter years ago, and my mom would text me after every newscast, and she would say, "You needed more lipstick today." Mom, I covered a murder trial, but that's what you got out of it, is I needed more lipstick? So, parents, am I right? All right, you guys, this is our final panel of the day, and I actually forgot to tell y'all, these beautiful flower arrangements from Tucker Floral are gonna go home with two of y'all today, one each. Yes, thank you. That was the appropriate reaction. And so I have some names that we randomly picked here, but you have to stay through the rest of the seminar. And I know you want to because we have some amazing experts. I love both of these doctors tremendously. They're so incredibly smart and talented. So I'm excited to introduce them both to you during Breathe Easy, How to Keep Your Lungs Healthy. So lung cancer is the deadliest cancer in the US, yet it's often misunderstood. Many women don't think they're at risk. Symptoms can look different, and too often, diagnoses happen later than it should. So our goal today is pretty simple. We're gonna give you clear, plain language and information, help you recognize those warning signs, and to show you when and how early screenings can save lives. I'm joined by two Covenant Health pulmonologists and critical care specialists today, Dr. Shannon Turnbow and Dr. Ximena Solis. Dr. Solis is a pulmonary and critical care physician who earned her bachelor's degree in microbiology and biochemistry, which I hear is the hardest one to get, from Texas Tech University. She completed medical school, internal medicine residency, and pulmonary critical care fellowship at HSC. She's been practicing in Lubbock for about 5 years and is committed to providing advanced compassionate care to critically ill patients. Dr. Shannon Turnbow is a pulmonary and critical care physician with more than 2 decades of experience serving the Lubbock community. She's a Texas Tech University graduate. She completed medical school at HSC, an internal medicine residency at HSC, and a pulmonary critical care fellowship at the University of New Mexico Health Sciences Center. She's been practicing in Lubbock for 22 years. Let's start with you, Dr. Turnbow. Tell us about lung cancer and why it is so deadly and especially dangerous for women.
Okay, can you hear me? Everybody can hear me? Okay, good.
Oh, that's us. There you go.
Here we go. Okay, so first of all, I think there's a stigma associated with lung cancer, and I think when people think about lung cancer, they think, oh, you did it to yourself. You know, you smoked, it's your fault, you did it. And that's true for almost every disease process, right? So we need to eliminate the stigma of lung cancer. Lung cancer is a serious, deadly illness, and if you think you have symptoms, if you're at risk, you need to get screened. You need to get checked out. So lung cancer is the deadliest cancer in the U.S. still, mostly because it's diagnosed at a later stage than most cancers, because it's mostly asymptomatic until it's already spread. Women smokers are at higher risk for lung cancer than men. Even when you compare amount of time smoked, cigarettes smoked, etc., women are at higher risk. And women are often diagnosed later, at later stages, often because, again, there's this stigma, they don't get screened, they ignore symptoms, etc. Who's at risk? Almost all smoking. 80 to 90% of those who are diagnosed with lung cancer are smokers. Not 80 to 90% of all people who smoke will get lung cancer. It's just the population is mostly mostly smokers. There are a small percentage of people who are non-smokers. The majority of what we see now are older women who've lived with their husbands who smoked for years and years around them, 50 years in the same house with him smoking 2 packs a day. And they wind up with lung cancer from secondhand smoke. Radon gas, not all that important anymore, and then environmental exposure is not really in this country. That's more of like indoor wood burning stoves, etc. So again, smoking is the number one cause of lung cancer. The picture on your left is a CAT scan of your lungs. A normal healthy lung is mostly black with a few white streaks through it. That big white spot in the left upper corner is a tumor. Most likely a lung cancer. And then just for comparison's sake, everybody talks about a smoker's lung. It's real, You don't necessarily have to have COPD or lung cancer to have a lung that looks like that. That is smoking, all the tar associated with it, chemicals, et cetera, compared to the healthy pink lung. Okay, so some common symptoms of lung cancer can be unexplained fatigue, you just feel tired, not sure why, shortness of breath with just your normal everyday tasks, unexplained chest and back pain, unexplained weight loss, a persistent cough, and usually when we talk about a chronic cough, that's a cough that lasts more than 6 weeks. Commonly referred to as a smoker's cough, so it usually is productive of some mucus or sounds like it could have some mucus in it. And then a red flag is coughing out blood. That's never a normal thing. It's not something that should be ignored. Lung cancer is not the most common cause of coughing up blood, but definitely if you do cough up some blood, you should be seen by your primary care right away. And there should be some imaging associated with it. You should at the very least, get a chest x-ray. Smoking doesn't just affect your lungs and doesn't just cause lung cancer. We just heard our cardiologist talk about how important smoking is with cardiovascular disease and peripheral vascular disease. It can also increase your risk for gynecological cancers like ovarian, cervical, uterine. It can cause infertility and difficulty with your menses. And then pregnancy complications, most of the time, small babies, so small for gestational age babies because they don't get the blood flow that they need, and then premature birth. And then some non-cancer causes, COPD and emphysema, that's huge with smoking. Not everybody who smokes will get COPD or emphysema, but that is the number one risk factor. And then osteoporosis is very common in smokers. So how can you reduce your risk? And this seems to be a really common theme in our talk today, but exercise and maintaining a healthy weight is very important. Sorry if y'all can't hear me. And aerobic exercise, so getting your heart rate up for at least 25 minutes, 3 to 5 days a week, eating a healthy diet, not eating a whole lot of processed foods. And then when we talk about lung strength in particular, building your upper extremities is very important. So I think that's something that women ignore, is doing upper extremity exercises, but strengthening your arms and your shoulders can help strengthen your respiratory muscles. This is Meredith.
This is me again. All right, you guys, we're going to do math. And I was ensured it was easy math because I am not a mathematician by any means. So if I can do it, y'all can do it. So you guys got a program, and so you can take that out and use that, or your cell phones all have, calculators on it. But we are going to calculate something that is called pack years, and then Dr. Solis is going to explain to us what that means. So pack years, if you are a smoker, multiply your packs per day by years smoked. So if you smoked 2 packs a day for 15 years, it would be 2 by 15. All right, everybody take a minute. Let's do our math. All right, Dr. Solis, can you explain to us what that means?
Hear me? Okay. So yeah, here's our calculation for pack years. And the reason this is so important for us is this lets us know who is eligible for lung cancer screening. Because as Dr. Turnbow said, it's one of the deadliest cancers, even with all the technology and how far we are in the game. In the medical fields, this is still something that kills people every day. So if you take your pack year history, we have to think about these other things that it's very hard to quit. There are a lot of hormonal factors, genetic factors. Women, we're always concerned about weight gain. And of course, it's one of the most addictive substances, even hard drugs, alcohol. Smoking is a heavy addiction as well. And so early detection is key for lung cancer. And so we take that pack year history that you guys just calculated, and that lets us know who's eligible. And I'll go into that here in a minute, but just kind of some things to say how important screening is. The goal with lung cancer is always to find it at an early stage. If we're able to find somebody at a stage 1, that is the best case scenario. That increases your chance of survival. And so we find that these stage 1 cancers, if a patient is in a screening program and we find a stage 1, half the time, we're able to catch it. But someone who's in the not screened and we find a lung cancer, it only occurs 27% of the time, okay? You can reduce your mortality by 16 to 21%. And for most patients, this lung cancer screening is $125 out of pocket. And it's something that may save your life. So the way we do lung cancer screening is with a low-dose CT scan. Basically, it's a 10-minute test. You walk in, the CT scan looks the same as any other CT scan. The only difference is how we format the images. It's a lower dose of radiation for the patient. And so we are looking at a chest x-ray here on the other side of the screen. That tiny thing that I bet you guys can't see, that is a pulmonary nodule that potentially could be a stage 1 cancer. Most of the time these things are missed on x-ray. You can't really get the amount of detail that we can with the CT, so that's why we recommend a low-dose CT. And so this pack your history comes into play here. So current guidelines recommend people that are 55 to 80 be screened. They have to be current smokers or having quit in the past 15 years. We use this calculation, the pack year history. So if you have an over 20 pack year history, you are eligible for lung cancer screening. There is a move with recent research and data to lower that age to age 50 because we are seeing patients who are younger. But currently, if you're above age 55, that's the current recommendation for that. And so we have some resources for you if you feel like you may be a candidate to be screened. You need to be honest with your healthcare providers. Like Dr. Turnbow was saying, there's a certain stigma behind smokers. We're not asking these questions to be nosy. It's because you potentially could qualify for this intervention that can change your life. And so we're here to help. We actually recently set up a lung nodule clinic to take care of these patients. We will see who qualifies, look at the imaging, if something even is found incidentally, and we will follow up on these scans, do certain risk stratification tests as well, and even do biopsies or procedures that may be needed. We also have resources here at Covenant, such as a smoking cessation program that we can refer you to. And so the reason we ask these questions, like I said, it's not to be nosy, it's to potentially intervene. And if you do have something, improve your outcomes.
Dr. Solis just mentioned it, but Sarah Tello is our nurse practitioner who runs our smoking cessation program. She is actually out in the hallway at a booth. And so if you or a loved one maybe needs support in that area, she is out there and she is fabulous. And Dr. Solis, before we get to Q&A, because we just launched our lung nodule clinic in the fall and it's been really successful, can you just explain to the audience a little bit more about the benefit of getting those patients in quicker, because then we can detect it faster, get them over to Joe Arrington for treatment faster, and so on and so forth?
Certainly. So a lot of the times, for these lung cancer screenings, I should have probably expanded on this. When we find something, where current guidelines, depending on a patient's risk, we will either recommend follow-up imaging. We would recommend potentially a PET scan if something is concerning. Obviously, if something is concerning enough, sometimes we go straight to a procedure, straight to biopsy. And there's different biopsy options as well that we can discuss with the patient. Kind of like I mentioned before, the goal is stage 1. So if we have a streamlined process, and that's the whole reason for having this clinic, a streamlined process to where we find something, we're able to, within a couple weeks, do a procedure, and then the following couple weeks get started on treatment. Time is what's important, because if you do have a lung cancer, 6 weeks can make all the difference. It can change your stage. And so we're wanting to stage shift and get these patients taken care of at a stage 1. That is the entire goal behind this, because in the lung, things can grow and you have no idea. There's no, unless you have those late warning signs, there's no pain receptors in the lung. You can have massive tumors and not even know about it. So we're just trying to get these patients taken care of as quickly as possible with that.
Thank you so much. Can we have our other experts join us back up here? We've been doing pretty good on fielding questions, but we may still need y'all. So a couple of takeaways from that presentation. If you have not started smoking yet, Please don't start. We've heard that from every single one of our experts today. I don't know how much more to explain that. Please just don't do it in the first place. If you are a smoker, smoking cessation is a great tool for you or a loved one. And again, we have resources for you right out there in the hall. And then early detection is key. If you qualify for screening based on that pack here that we did, make an appointment with your doctor, please. All right, we have some questions. Number one, are there differences in how lung cancer develops or behaves in women compared to men?
I don't think necessarily it's not more aggressive in women or anything. There's different types of lung cancers, and each type has its own kind of doubling period and growing time and how it responds to therapy. I think also we're seeing a lot of lung cancer in non-smokers, kind of like Dr. Turnbow was explaining, secondhand exposure. But then there also are types of cancers that occur in non-smokers equally as they do in smokers. So it not necessarily in women. I always tell my patients I feel like women are less likely to complain, and that is dangerous sometimes. And so I think it's more of that, but not necessarily, hormones and things can affect certain tumors, but as a general rule, not so much. But
it sounds like we've focused a lot more on traditional cigarette smoking, but there's other options out there now. There's vaping, there's marijuana usage. How does lung cancer develop with those other habits?
The jury's still out a lot on vaping, I would say, because vaping is there's so many different ingredients in the juice that they call, but anything you inhale into your lungs that's not normal, it's abnormal, it's bad for your lung function. There's no known direct correlation between lung cancer and vaping. Vaping can cause a particular type of lung disease called popcorn lung, and that's a dangerous scarring of the lung, and it can actually be so severe it can cause death. It can cause the need for lung transplantation. So it's not like you're trading one bad vice for a good vice. You just shouldn't do either.
Air should go in our lungs.
Air.
Got it.
Yes, air.
Good to know. All right. I am not a smoker, but should I be getting screened for other lung and respiratory issues? Are we asking that right now because we've all been inhaling dust and dirt for a week and nobody can breathe? Because same, my inhaler has gotten a lot of use this week. But so what should non-smokers be getting screened for in their lungs?
So there's no real screening per se for kind of non-smokers. I think it's more, a lot of people, especially in West Texas, I think all this dust we're exposed to, everything in the environment. There are people that can develop like a reactive airway disease, and then obviously like the occupational exposures. I know there's a lot of people who work in the oil field and industry. It's more of symptoms. So if you are having symptoms like coughing, wheezing, short of breath, chest tightness, things like that, those are things you should probably discuss with your primary care physician and decide if it's appropriate to see a specialist for.
I'm going to follow up on that one because this next question is, can someone get sick from not cleaning your air ducts, or can it cause lung cancer? So again, all that dirt we're getting in our house.
So you can develop chronic infections, inflammation in the lungs from occupational things, also from certain infections, molds, things like that. You can get a condition called hypersensitivity pneumonitis, where you're constantly having like an allergic reaction to something, and it can be mold it's most commonly associated with. But yeah, I think definitely your environment is important when it comes to your lungs.
I did not pay anybody in the audience to say this, but I'm going to have it read. This is a quote. "We love Covenant Pulmonary team. Thank you for all the care and education you provide to the community." This person wants to win the flowers, don't you? You should have put your name on here. I will bribe with flowers. Okay, if you're a former smoker, can your lungs recover?
So, the earlier you quit, the better off you are. We're all born with extra lung function, so we're born with way more than we need. Over time, our lung function declines as a part of aging. So if you're one of those people who has very healthy lungs and you smoke and you're not one of those people that are at risk for COPD or asthma and you quit smoking early, you probably won't notice any difference in your lungs. So the earlier you can quit, the better. If, however, we see this a lot too, if, however, you're a smoker and you smoke for, say, 20 years, and then you quit, and then 20 years later you come to see one of us and you say, I quit smoking 20 years ago, why do I have symptoms? Because when you quit smoking, you had already lost some lung function, and then as you became older, you went through that natural process of losing lung function, and then you become symptomatic. So again, it kind of goes back to the earlier you quit, the better maintaining a healthy weight, exercising, etc. Your risk for lung cancer never goes back to that of a non-smoker, never. But every year you quit, your risk for lung cancer decreases. So you may never get back to that no risk, but or not the lung non-smoker risk, but the earlier you quit, the better.
For smokers and non-smokers, are there any exercises that help build up our lungs?
Yes. So again, what I was talking about, building up your upper extremities. So your upper extremities include your arms, your shoulders. You have muscles in your neck that actually attach to your chest. And when you exercise, those help your respiratory muscles work better. Deep breathing exercises are good, where like box breathing and things like that, where you can actually hold your breath for a little while and then let all your air out and then bring all the air back in. That can help exercise your lungs, especially there are a subset of people, especially people who have central obesity, who don't deep breathe and who the bottom parts of their lungs are not ever expanded, and that can lead to problems with your breathing in the future. So deep breathing exercises, maintaining a healthy weight, and exercising your upper extremities.
Raise your hand if you started deep breathing when she talked about it. Yes, I did too. I sat here in my chair and I was going. I told y'all the mind is a funny thing. All right, Dr. Solis, you already kind of mentioned this, but I don't know if you can expand on it further. What role, if any, do hormones play in the lung cancer risk or progression? You kind of touched on it loosely, so we're just asking.
They're not really. Not so much. Not so much with that.
Okay. The one thing hormones don't impact. Incredible. Yeah. How many other conversations do Brooklyn and I have in the podcast or here today where we're like, hormones are great. They make us wonderful women, but also they kind of stink, y'all. So at least not with lung cancer. Thank you guys so much for your time and attention today. All of you, thank you for your expertise, for sharing this with us. That actually concludes all of our discussions for today. We will be continuing our health screenings over in room B. Lunch will be served after this. Don't forget, you guys are going to get an email after this that has a link to all of these videos and all of these panels and some more great information like the FAQs we got today. So share those with your friends, share those with your family. I'm assuming you're all still sitting here because you want me to give you flowers, so I guess I'll tell you who won those. Is there an Amy Dauberstein? Hi, Amy. Amy is our first winner, and then, yes, claps for Amy. A Lisa Dossett? I'm sorry, say it again, yell it. Yep, that's it. All right in the back row. Thank you all for attending today. We really appreciate you spending your Saturday with us. If you have any feedback, please let us know, and have a wonderful weekend.